We are back with physician assistant Cody Martin with Cone Health Virtual Care with recommendations for staying healthy during the holidays. All right, so this is what we talked about just before we took this break, was what are the options available for care during the holidays? Because as you mentioned, some provider offices are just going to be closed.
Yeah, so if unfortunately you find yourself needing care on a holiday and you know that your primary care office is closed, there are several options. First of all, especially if you have, more of like a mild illness, like, oh, I think I have a cold, or maybe I did lift something heavy, my low back is hurting. Cone Health Virtual Care is a great option. We are available 365 days a year, including holidays, and providers are seeing patients generally from 8 in the morning until 8 in the evening. If you have more substantial symptoms, then we would want you to be evaluated at one of Cone's urgent cares, or, heaven forbid, if it's something severe, life-threatening, the emergency department is always available, and the providers there are ready, willing, and able to take care of you.
All right, so what happens if we're traveling later on this week and we get sick while we're out of town? What should we do?
Sure. So if you happen to be out of town but still within North Carolina or Virginia, you still can use our Cone Virtual Care services. All of our providers are licensed within North Carolina and Virginia. So as long as you're within those states, we can still see you again every day of the year. If you happen to be out of state, then especially with your primary care office being closed, we would want you to seek care locally. So at an urgent care or an ER facility, we certainly wouldn't want you to delay care.
Okay, so with traveling in mind, what do we need to make sure that we take with us when we are traveling out of town?
Yeah, so first and foremost, and this isn't just for the holidays, but if you're traveling away, you want to make sure that you have all of your prescription medications with you, right? That you planned, not going to run out of them right before you have to leave. You just don't want to be without those prescriptions, right? So a little planning ahead can really be beneficial. Same thing with testing supplies. So if you're a diabetic, you want to make sure that you packed your glucometer, your testing strips, your lancets. You want to have enough to cover you through that travel period. I do always recommend carrying some disposable masks with you, having that hand sanitizer on hand. And if you're traveling, either via plane or car, having a first aid kit available, right? I keep one in my glove box so that I always have one with me if I'm traveling.
And then you don't have to stop along the way because the trip is already long and all that other kind of jazz to get aspirin or Band-Aids or whatever you need. Okay, what kind of symptoms should we be calling 911 for and not delaying, whether it's the holidays or not?
Sure. So of course, if you're having any substantial chest pain, right, any substantial shortness of breath, any dizziness, or if you, heaven forbid, you've passed out, right, those would certainly be reasons. Any severe abdominal pain, especially if you're having vomiting and you can't stop, you can't stay hydrated, or of course if you have any severe injury or say, a car accident, things like that, we would want you to be evaluated at the nearest emergency room, and of course calling 911, especially if you're alone or if you don't have someone that can get you safely there in a timely fashion.
All right, and we've got just about a minute or so left. Any final thoughts on staying healthy during the holidays with all the festivities and the options for care?
Yeah, so we want everyone to stay happy, healthy, have a great time. So I would just say, again, hand washing, hand washing, hand washing. One thing I didn't mention earlier would be even like Lysol and shared surfaces. So countertops, sinks, doorknobs, that can be very beneficial. And then if you're feeling under the weather, stay home and until you can get evaluated and we can make sure what's safe, okay?
Yeah, you might have to do a FaceTime or something like that with your family or friends. You hate to miss something, but at the same time, you also hate to spread something.
Absolutely, absolutely.
For sure. Okay, all of this is going to be in the To Your Wellbeing section on our website.